So my name is Dr. Weiner, and I'm a weight loss surgeon. And I wrote a book called A Pound of Cure a couple of years ago now. And I've also put a lot of videos on YouTube, and I've recently created an entire website that is a pretty comprehensive resource for anyone who's considering weight loss surgery. I've got about 150 videos. On YouTube, I think there's somewhere around 40 to 50 videos. And I looked at YouTube videos kind of as like almost like a TED Talk, like an interesting talk on a certain topic where you finish, you say, oh, that's interesting. That's a new way of thinking about things. But at that point, you're kind of unsure about where to go as your next step. I think the new website that we've created, which is at www.poundofcureweightloss.com, is a much more comprehensive and deep dive into what it's like living with weight loss surgery, what the whole process is about, and what you need to know if you're considering these surgeries or if you've had one of these surgeries. And we've got about 150 videos, and it's almost like a course. There's probably, I don't know, at this point, 20, 30, 40 hours of total video. If anybody has any questions, feel free to post them. And really the purpose is for the next half hour or so, you post questions about nutritional issues, about weight loss issues, about anything that pertains to good nutrition or success after bariatric surgery. So I just finished a video today on a very common topic that I see in my patients about pregnancy. And I think, some people, especially after bariatric surgery, have some concerns. Can you have a baby safely after weight loss surgery? Does it increase your risks of birth defects or anything like that? Of course, everybody's concerned about that. And the truth is that there's actually a lot of benefit to having weight loss surgery before pregnancy. There are some risks, and we encourage patients to take at least 1 year after surgery before becoming pregnant, but ideally 2 years. And even at 2 years, there's still, in some articles, a small increase in the risk of preterm labor. But if you look at the risk of pregnancy, when you're suffering from obesity, we see higher rates of preeclampsia, higher rates of birth defect, higher rates of emergency C-section, higher rates of complication as a result of C-section, higher rates of something called macrosomia, where the baby's head becomes too big, which can make birth either very difficult or require C-section. We see higher rates of gestational diabetes and all kinds of issues. And so what we find is that pregnancy after surgery is actually very safe. And I've had at this point, dozens and dozens of patients go through this. And really they do like pretty much everybody else does. It's really important to be very mindful of your weight, not just for your own weight loss success, but eating well during pregnancy is critical to reduce the incidence or the spread of your genes onto your child. There's something called epigenetics. And epigenetics essentially means that a certain gene is turned on or off as a result of your in utero or young or environment as a very young infant or child. And so if you, even though you may have genes that promote obesity, when you go on and become pregnant, if you eat really, really well and make sure that your unborn baby is in an environment where the nutrition is adequate and there's not processed foods and sugary foods and fatty and greasy foods, then we don't turn on those genes that promote obesity. So there's a question here. Will I not feel hungry after vertical sleeve gastrectomy? If only it was so simple. If only the surgery prevented you from feeling hungry for the rest of your life. The answer to that question is yes, you will not feel hungry in the first few months after surgery. However, down the road, it's entirely possible, in fact, likely that your hunger will return. And we have to remember this idea of your body's set point. And on the website, poundofcureweightloss.com, I've got a ton of videos that address how this whole thing works and what happens with your hunger afterward. And really, I call these kind of two different phases of surgery after surgery. The period initially after surgery where you have really good hunger control and aren't looking or seeking out food. I call that the honeymoon period. And of course, all honeymoon periods must end. And typically after a sleeve, that'll end somewhere between 1 to 4 years afterward, probably more likely in the 1 to 2 year range. Getting out to 3 or 4 without having significant hunger is unlikely. And what happens is that initially after the surgery, your body thinks that it should be, say, 150 pounds, but your body weight is still at 250 pounds. So your brain thinks you should be much thinner than you actually are. And so your brain works to increase your metabolism and also to decrease your hunger. Now, as you go from 250 to 225 to 200 and eventually down to that 150, your new set point and your body weight and your brain weight are the same, then the hunger returns and you kind of become like any other 150-pound person in terms of how they can maintain their weight. And if they take medications that cause weight gain, or they eat food that causes weight gain, or they do other, live a sedentary lifestyle, all of those things that can promote weight gain, you can then put that weight back on again. So that's kind of a long answer. I'm seeing a lot of familiar names there. Will I experience continued or worsened hypoglycemic episodes? So I haven't quite created, I've got probably about 6 or 7 more videos that I need to create, and one of them is on hypoglycemia. We should have that up on the website within, I'd say, the next few weeks. So first of all, the answer to that question depends on whether you're having a gastric bypass or a sleeve gastrectomy. So if you're having a sleeve gastrectomy, things really shouldn't change too much. The hypoglycemia is really not affected by a sleeve gastrectomy. However, a gastric bypass, it really is affected significantly. And we do see some worsening of hypoglycemia. Now, most hypoglycemia that we see is what's called reactive hypoglycemia. Reactive hypoglycemia means that if you eat a processed carbohydrate, then initially you'll see a big spike in your blood sugar, and then your body responds by releasing insulin, and in fact over-releasing insulin, and we see the blood sugar plummet. Now, the treatment for reactive hypoglycemia is to not eat that processed food in the first place, and instead eat food that causes a slow release of carbohydrates, like, say, beans, for instance. And so if you eat foods that are high in fiber and high in kind of slow release carbohydrates that are known, one common one that we see in beans is something called amylose, that keeps the blood sugar stable. If you eat some processed food, your blood sugar is going to plummet. That's not necessarily hypoglycemia. That's the result of eating something that you really shouldn't be eating. Your body is very sensitive to it. And instead of trying to treat it with medications, the right way to treat it is with diet. But we absolutely do see an increase in hypoglycemia, and occasionally, in relatively uncommon circumstances, we can see it as a result of eating even unprocessed foods, where patients can over-release insulin, almost kind of the opposite of diabetes, where the surgery we all know gastric bypass works to help treat diabetes, but if it kind of overshoots, then you can actually over-release insulin, and as a result, you can become hypoglycemic, even if you're eating the right foods. So the answer is that if you're having a gastric bypass and you're suffering from reactive hypoglycemia, which again is 98% of all the hypoglycemia out there, is reactive. It's if you didn't eat the processed food, you wouldn't have the hypoglycemic episode. So if you're having that right now and you have a gastric bypass, that's going to get worse. And the obvious treatment is to avoid the processed foods that trigger this. Laura Amiser, Meg Whitman, how are you guys? Oh, we've got Barry Jamal. Hello, I live in Finland and going to have a sleeve week 43. I'm not sure what week 43 is. Maybe you guys keep time differently than we do in Finland. And I'm kind of worried about hair loss. What should I do to prevent much hair loss? So first of all, and I do have a video on the website about hair loss. We really see it much more so after a gastric bypass. You can see it after a sleeve gastrectomy, but it's much less so. And it just doesn't really have the same severity that we see with a gastric bypass. So what can you do to prevent it? Well, another piece of that puzzle is that the more weight you lose, the more hair you lose as well. So hair loss is definitely directly proportional to the amount of weight loss. So without knowing, what your starting weight is, and of course there's no way for us to know what your finishing weight is going to be at this point. We don't know how much you're going to suffer from hair loss. But again, with sleeve patients, we don't see as much. So what can be done to prevent it is first to stay up on your protein levels from the very beginning, to be getting, in my practice, I use 50 grams for women and 60 grams for men, to get as much of that protein in as they possibly can, as early on after surgery, and not to really go through a period of severe protein malnutrition. Another thing is potentially to take an iron-containing multivitamin. I typically don't start my bariatric patients on an iron-containing multivitamin in the first few months because they're that much harder to take, and we're already struggling in those first few months to be able to take your vitamins because it can be nauseating. And so I want to kind of compromise on that. But there are iron supplements that you can take, and they can be tolerated, and sleeve patients tend to do a little better with vitamins than gastric bypass patients. And so you can take some iron. I also recommend biotin. Generally, I recommend high doses of biotin, 10,000 micrograms or 10 milligrams of biotin, which generally is going to require at least 2 pills. Usually they're sold only in 5,000 milligram or 5,000 microgram or 5 milligram doses. So a decent amount of biotin as well can be helpful. There's some brushes out there, some ultraviolet brushes. Some people talk about using Rogaine. I'm not so sure that that's going to be all that helpful. The good news about hair loss is that it's temporary. And, within a couple, probably 2 years out from surgery, your hair is generally back at its original thickness. So as much as it can be very distressing, at least it's not permanent. But the truth is, the more weight you lose, the better off the hair loss is going to be. All right, any other questions out there? Let's see. So another thing that I talk a lot with my patients about is alcoholism. And I think that's something that we've been really reluctant to discuss with our patients, and people tend to be hesitant to discuss it with their physicians or their surgeons because, of course, there's a lot of social stigma about abusing alcohol. But we know without question that a gastric bypass increases your risk of developing alcoholism. It changes the way your body absorbs alcohol, and as a result, it really becomes a very different drug, and probably a more addictive drug. So we see people who've kind of spent, their 20s, 30s, 40s, really never having any issues whatsoever with alcohol, all of a sudden after surgery, starting to increase their alcohol consumption to the point where it really becomes problematic. Alcohol will hit you much faster. You get drunk off of less alcohol. Oftentimes you can stay drunk longer. Particularly for women, one alcoholic beverage can put you over the legal limit for driving. And I've started talking more and more about my patients, both preoperatively and, of course, postoperatively, about their alcohol intake. And I think patients who tend to be heavy alcohol users before surgery should be very, very careful choosing a gastric bypass because it can take someone who essentially has a fairly well-controlled alcohol habit, maybe a little more than average, but very well controlled, and it can potentially make it uncontrolled. And when we look at these surgeries and we look at all the things that can happen after these surgeries, in general, and I've worked through this with several thousand patients at this point, even the patients who have issues after surgery really still do end up with a better life, with more quality of life. And the vast overwhelming majority of people are very grateful after their surgery and thankful that it did in fact change their life and improve their life significantly. The exception to that is people who suffer from alcoholism. And if you suffer from alcoholism, life is pretty terrible. And I think that's something we have to be much more vocal about. We have to talk a lot more about after these surgeries. because I think awareness is probably half the battle. So patients who really haven't integrated alcohol into their lifestyle can, when they start noticing the first signs of perhaps an increased desire or increased consumption of alcohol, can kind of figure this out from the very beginning. Alcohol, it doesn't happen overnight. You don't wake up after surgery, have one drink, and all of a sudden are on a bender. It's something that happens gradually, really over a period of years. And I think early conversations, open conversations about this are very important. I think if you think you may have an alcohol problem and you've had bariatric surgery, talk to your surgeon about it. We're going to understand that this is a physiologic issue and not necessarily, well, obviously it's going to have social implications, but it's not a character defect or a willpower issue or anything like that. It's the result of the surgery. And I think we have to be honest about this, and there's a lot of data out there to suggest that this is real, that this is not transfer addiction where you've taken one addiction for food and transferred it over to alcohol. This really is a change in the physiology and the change in the way alcohol hits your brain. And it's particularly noted in gastric bypass patients, really less so in sleeve patients. So I think that's an important message that we have to start getting out to our patients. That you really need to seek treatment, that this is not necessarily your fault, and keeping it secret is not going to make it go away. In fact, it's just going to get worse. Hi from Maine. Hi, Denise. How are you? Megan, some people are so strict with not drinking for a half hour after you eat. Sometimes I just need some coffee or a little water. Will this screw up my stomach? So I just actually finished a video this afternoon on weight loss surgery myths. And one of them is about drinking and eating at the same time. And the answer to that is no, it most likely will have absolutely no effect on you. To not drink and eat, to me, seems really difficult. I mean, I drink and eat all the time. That's a very, very common thing to do. And I think to put that restriction on someone for the rest of your life seems really hard. And there's not even a tiny bit of scientific evidence to support this statement. It really kind of is this old thing that somehow people thought you would wash the food through your pouch and it would cause you to eat more. I'm not even sure where it came from, but it really has no scientific basis. I will tell you, I have had some patients, particularly in the first 6 months, maybe even a year after surgery, and occasionally a little longer, who will tell me that if they drink and eat, it hurts. It's just overwhelming. It's too much for them. Now, this doesn't mean it's going to stretch things out. It just means it's uncomfortable. So if it is uncomfortable to eat and drink at the same time, then don't do it. I think if it doesn't bother you and it's not going to impact your weight loss. We have to focus on the things that are important. Things that are important are changing the types of food you eat, making sure you exercise regularly, as we talked about, avoiding things like drugs and alcohol and other lifestyle issues. These are the important things to focus on. When we start focusing on how many ounces of water you drank when you're 2 years out from surgery, it doesn't really impact your health or your life. Whether you drink or eat at the same time isn't going to be a major player. And so when you put all these obstacles in terms of your life, it just makes things unnecessarily hard. So Megan, drink and eat tonight for dinner if you like, and as long as it doesn't hurt, you can keep doing it. So Jamie Farrell, I've had a dodgy gallbladder for years. Is it possible to have a cholecystectomy along with a sleeve gastrectomy? It absolutely is. And I've done that a bunch of times, and especially a sleeve, I think it's pretty reasonable. My general philosophy on this kind of stuff, though, is, having a gallbladder out is generally a fairly low-risk surgery. We do it typically as an outpatient. A sleeve gastrectomy is kind of a low to medium risk surgery. The problem is when you take a low risk surgery and say a low to medium risk surgery and you mix them together, you get a medium risk surgery. And so the question is, which is it better to do, a low risk surgery and then later on down the road, a low or medium risk surgery? The more, as I kind of talk to patients, complications don't add, they multiply. So I think it's important to recognize that we kind of, when we do these surgeries and we're able to do, say, a sleeve gastrectomy with less than a 1% complication rate, we achieve that by having things, very organized in kind of a step-by-step fashion, where you kind of come into the operating room and it's almost, I don't want to use the word assembly line because that kind of means that there's not care or consideration and it's just kind of automatic. But there is something in the structure and routine of doing these surgeries over and over and over again that is necessary to get the complication rate down so low. So as soon as you throw a wrench into this whole mix, like, oh, when we're done with that, we'll take out your gallbladder, it breaks up that routine. It breaks up that curtain of safety that we've established, and essentially puts us into slightly, more of an innovative role as opposed to a routine role. So I generally, if it's really important, I will take it out. If someone's gallbladder is pretty symptomatic, I will. But if you have stones and they're not bothering you, and we're doing a sleeve, I might encourage you to kind of hold on to that gallbladder a little longer. That's something to talk to your individual surgeon about, but it certainly is something that can be done. Pinky Pearson Sisung, hey, I feel my portions are bigger than other VSG patients. I had surgery 121. I can definitely eat more than 4 bites at a time. I feel great though. Is that a problem? We have to remember that sleeve gastrectomy is not a restrictive surgery, meaning it doesn't work by blocking you from eating. It works by removing a portion of the stomach that releases ghrelin and plays a role in leptin and several other hormones that impact your metabolic rate and your appetite and your body fat storage. And so I don't really try to read too much into patients who can only eat a few bites at this point versus who can eat a little bit more. So if your weight loss is on track, then I would essentially consider yourself lucky. It sounds to me like you're having a really easy recovery. It's like you have a good functioning sleeve, and I wouldn't get too worried about it. I think if your weight loss is not on track, then you have to be a little more careful and figure out what's going on there. Was a portion of the stomach that should have been removed left behind, things like that. There's also a genetic component to this whole thing, and so even with a perfect sleeve, you can still not lose as much weight as an average patient does. So there's a lot to that question to answer, but my general response would be, if you can eat a little bit more than other people, I wouldn't worry too much, especially if your weight loss is on track. Then I would say just, eat more fruit, eat more vegetables, eat nuts, seeds, beans, eat these foods that actually cause weight loss. And you can end up succeeding as much as, or even more than an average patient does. That's not really what's driving this. It's a hormonal situation. All right. Have you done or will you do a video addressing why the POC is better than the keto diet, which is the current fad? So I don't know if I'll do a video on that particularly. I do have a lot of videos on animal protein, though, on the website, and on refined oil on the poundofcureweightloss.com website. And that's really a big component of the keto diet. The keto diet, in my mind, there's a couple of failings. The first thing is it's essentially just a rehash. It was originally, the carbohydrate restriction went back over 100 years in terms of the diet. I think even longer than that. But it was popular in Europe as a Duquesne diet. Then it was the Atkins diet. Then we kind of switched over. We started calling it paleo. Paleo didn't last that long, and we're now on to keto. But the idea is restricting carbohydrate. And then there's talk, how many net carbs, 20 net carbs, 40 net carbs. This has been kind of done over and over again. I was really happy to see in the Journal of American Medicine an article that stated that a carbohydrate restricted diet will shorten your lifespan. And I think that's because you're eating a lot of animal protein. We know animal protein, eating a lot of it will shorten your lifespan. Causes obesity, causes dementia, causes high blood pressure, causes heart disease, causes diabetes. We know that there's a direct link to how much meat you eat versus these diseases. And I think that's what explains why we're seeing that in the low carbohydrate diets, because if you're not eating carbs, you're eating meat, most likely. To go on a low carb vegan diet is pretty much impossible. So I don't know if I'll make a video about that, but I have a lot of there's a lot of issues on the website about how about the benefits of beans and the dangers of animal protein and what we can do to kind of eliminate those. Okay. At what point do you see patients need their gallbladder out? I had some right-sided pain, but they didn't see gallstones. I'm approaching 6 months bypass. I lost about 83 pounds. So the answer is, if you, first of all, if you don't have, sorry, I'm just turning off my phone here. If you don't have gallstones, you don't need your gallbladder out. End of story. And you might have had some right-sided pain. That could be musculoskeletal, that could be a cramp, who knows, but it doesn't necessarily have to be your gallbladder. So I don't recommend anybody get their gallbladder out routinely, and probably only around 1 in 6 patients after weight loss surgery will end up having their gallbladder out. And it's not like 0 patients in that same age range have their gallbladder out. So there is certainly an increased risk of gallstones after weight loss surgery, but it's not dramatically so, and certainly doesn't warrant either a pre-operative or during the weight loss surgery taking out your gallbladder. That's kind of a remnant of our days of open surgery, and I could go into the details of why that was done. It isn't right now, but it's not really that important just to know we don't do that anymore routinely. As I talked about it, I try to avoid it if at all possible. If you have stones, we take it out and they're symptomatic. Gastric bypass patients, I think you have to be particularly careful because the stones can be more problematic after a gastric bypass than they are in a patient who's had a sleeve or has never had weight loss surgery, because we're not able to get access to the bile ducts the way we typically do. By going through your mouth, we can't get our scope toward the bile ducts, and it makes it trickier if one of these stones gets stuck in the main bile duct. So, Dawn, what I would say is if you don't have gallstones, you don't need your gallbladder out. How long can I use protein drinks for a major part of my intake? I'm struggling with food, had VSG 7-18. So I do have a video on that on the Pound of Cure website about when to give up protein shakes. And essentially the long and the short of it is, as soon as you possibly can, you should. What I use is I use your pre-albumin level, which is one of your blood tests, which measures protein. As soon as that normalizes, then I encourage patients to adopt a veggie first approach instead of a protein first approach. But if you had surgery, it looks like about 2 months ago, you need to be on protein shakes right now, especially if you're struggling to keep enough food in. So this is something to talk to your surgeon about, but that's something, you certainly need them. I also talk a lot about homemade protein shakes. You don't need to buy the store-bought ones. Remember, the store-bought ones have artificial flavor, artificial sweetener, and really processed animal protein. You can make them with yogurt and peanut butter and fruit and even some spinach or other green leafy vegetables. You can get 20 grams of protein in those, and they are delicious, and they're often much better tolerated and can be a great replacement for the store-bought protein shakes if those aren't your thing, because they can be pretty sweet and not very palatable after surgery. Timothy Lynch, down almost 200 pounds total after a sleeve. Way to go, Timothy. That's amazing. Just over a year ago, lost 50 pounds before surgery. So 200 pounds of weight loss. I've got a bunch of people at 200 pounds, but not that many. That really is an amazing accomplishment. You should be very proud of yourself. And I hope that you've used this to really launch a much healthier lifestyle and are eating lots of whole unprocessed foods like fruits, vegetables, nuts, seeds, and beans, and are starting to exercise and making the best out of this weight loss. That's really awesome. Jamal Berry, week 43 is 22-10-26 in Finland. Thank you for your answer. I watched all your videos last year and I got my date or week of surgery last week. I used biotin, but what's the maximum dose of biotin? I don't know the maximum dose. I tell people 10,000 micrograms a day. I'm not sure there's going to be much benefit after that. It's probably just going to go right into your urine. All right, Timothy Lynch. Any case, lost most of the weight in the first 10 months. Lately, it's been in spurts. Lost some of my focus on my diet. Focus shifted away to work, etc. So the idea of what it sounds like you're talking about, Timothy, and I think Timothy is the one who lost 200 pounds. Is that right? Yes, Timothy is the one who lost 200 pounds. So yeah, the weight loss eventually has to stop. Your goal weight's not 0 pounds. And what happens is initially you're losing weight relatively rapidly, but even in that rapid weight loss, there's going to be plateaus. And there's a video about how much weight you should lose, you're going to lose, and how this all happens, and how often you should weigh yourself, and how you kind of handle that on the new website. But what happens is eventually it starts to slow down, and you get, longer plateaus and shorter spurts of weight loss. And what happens then is essentially what we're seeing is that your set point and your body weight are now equilibrating. And when that happens, you become much more like a normal person. And this is what marks the transition from the honeymoon period to the end of the honeymoon period. And it's this period, Timothy, that is probably one of the most critical ones and the most important times for you to focus on your diet, because losing track right now can essentially allow you to kind of go back to some of your old eating habits. And if you go back to eating the same way you were before surgery, after surgery, most likely your weight is going to start heading back towards your weight before surgery. So right now, Timothy, 200 pounds is amazing. You should be very proud of yourself. But the work is not done. In fact, the hard work is not done. The hard work begins now, and regular exercise and a really great diet is what is going to be necessary for you to maintain that weight loss. And as much as it's, we all want to cheer you on and congratulate you, and nothing's more fun than sitting with a patient who's a year out and describing how much their weight loss has helped them and improved their life, it also is critical that we really lay out the steps that are necessary for you to maintain this, because you losing all this weight for a couple of years is not worth it. We need to figure out how you can lose this weight for the rest of your life. And it takes hard work and a really great diet to do that. So I think right now, Timothy, I would tell you it's time to get back on. Orlando, we started at 6. Babette Agawa, I appreciate you so much. Thank you for your generosity in helping people. I had surgery in Mexico and could not have survived without a pound of cure and your great help. Thank you so much, Babette. I hope you're doing well. And let's see, Rachel Laughlin, does someone who has had bypass surgery need the same amount of calories for energy as a person with a normal stomach? Can we get by on less calories and have the same amount of energy? So Rachel, that really, that question, I think, is a very important one to understand about how weight loss works. We think that, based on your body weight, you need this many calories in order to maintain your weight, in order to survive. And what we find is that range, it's a big range, and it varies a lot on your hormonal status. And, eventually, if you've kind of lost a little bit of weight, your metabolism will slow down, and you can get by and maintain your body weight actually on fewer calories at that point. So the truth is, after a gastric bypass, how many calories do you need? Probably not a very different number than you needed before surgery. If we look at your to maintain a body weight of 400 or 500 pounds, takes more calories daily than to maintain a body weight of, say, 150 or 200 pounds. But if we just kind of go pound for pound and look at what your normal caloric burn is, then it's not going to change much after weight loss surgery. You're not going to have any different caloric needs than someone else who's your same weight and size and age. And what you'll find is that you can maintain your weight potentially on 2,000 calories a day, and you can maintain your weight on 1,000 calories a day. It's what is in those calories is as important as how many of them you're consuming. And then other factors like your muscle mass and how vigorously you're using your muscles and how much you're exercising and other things like that can influence things as well. I think what I noticed, though, is that once you've had surgery, it really becomes exceptionally difficult to lose more weight than you lost after surgery. And this is something I think that frustrates a lot of people when they hear it. A lot of people think differently about it, but you have that surgery, you start at 300 pounds, you get down to 180 pounds at, say, it's 18 months out from surgery, and that's where you are. It's really, really unusual to then go on and say, lose another 30 pounds. Maybe 5 or 10 at some point if you kind of clean up your diet a little bit. But to lose a substantial a substantially significant amount of weight from that kind of lowest weight that you stopped at within the first year or two after surgery. I don't want to tell you it never happens, but it's really, really uncommon. So what are your caloric needs? It's an impossible question to answer. What I tell patients to do is eat lots of really, really good calories and try to minimize the processed calories as much as possible. Orlando, you're one of the 200 plus pound weight loss patients. Thank you. Yeah, you've really done amazing. Gotten rid of your diabetes and everything like that. Here we go. This is Molly Spradley. I had an open VBG in the 90s and gallbladder out with it. Been very happy with my conversion to Roux-en-Y. Yes, VBG was kind of a terrible surgery. We don't do that anymore. The staple lines almost all broke down. Yeah, I'm sure you're much happier with a gastric bypass than a VBG. At the time you had it, it was probably a decision between the VBG and the gastric bypass. And it really just depended on what your surgeon was offering at the time. But we've kind of recognized the gastric bypass has stood the test of time, and the VBG is really of historical interest only unless we see patients, and I've done a number of these surgeries. They're actually pretty challenging surgeries to revise a VBG to a gastric bypass. Thomas, you're going to refocus on diet, already hitting the gym steadily. Good to hear. Orlando's 2 years out, maintaining 200 pounds. So Sherry, tuned in late. All right. Denise, Duval, Robinson, and then we'll see if we get one or two more questions after this, and then we'll wrap things up. My surgeon says not to eat raw vegetables until after 3 months. When do you recommend starting raw vegetables? So I don't have specific recommendations about raw vegetables. And when I talk, and my post-operative diet is all on the new website, I kind of spell everything out in detail. I generally kind of take it out to chicken, and at that point, which is usually about 6 weeks out, I tell patients, you can try other food, but try it carefully, try it at home, be mindful about it, a bite at a time. So, the thing about raw veggies is that it really depends so much on the veggies. And that's another, raw veggies and fruit too. There's so much variation in terms of what you can tolerate in those early phases of surgery. For instance, strawberries are really, really easy to eat. Blueberries, because of the skin, can be very difficult. Carrots generally are pretty easy to eat. Celery, because it's stringy, can be a little tricky. So I try to discourage patients from kind of going there for as long as possible. Instead of raw veggies, I would really encourage veggies in a soup or veggies in a smoothie. And there's a lot of people are kind of eager to get back and try all these new foods in the early stages after surgery. I think that's a mistake. I think you kind of circle your wagons and find what works and just focus on eating that and keep it very simple and very reliable and very predictable. And if you do that, you can avoid the potential missteps where you're sitting at work and you take 2 bites of a carrot stick, and next thing you know, you run for the bathroom throwing up, and all your coworkers are saying, oh, she had that surgery, and now she's throwing up all the time, and who needs that? So I really encourage people to keep it very, very simple for as long as possible after surgery, just to keep it comfortable. There's no need for these situations to arise, especially because in those first few months, you have almost no hunger, almost no desire for food. And there's just not a tremendous, need to be kind of trying everything out there. So even as much as I love raw veggies, I really don't push people to take them for, at least till minimum 3 months, probably even longer, because they can be very difficult. So it looks like we're out of questions. I think we've worked through, there we go, Dawn Ryder. Your focus on veggies and fruit first, and my doc wants protein first. How much do you really need for protein? I miss veggies. Dawn, this is certainly something, your bariatric surgeon and I are going to probably have to agree to disagree on. I can tell you I'm not the only bariatric surgeon out there who believes that we should be promoting veggies first, but the standard dog is protein first. That's what's out there. I use your prealbumin level, and which is a blood test, and somewhere around 6 to 9 months, maybe 6 months for sleeves, 9 months for gastric bypass patients, that prealbumin level starts to normalize, and when you're eating comfortably and that prealbumin level is normal, then I encourage patients to stop with the protein first approach and focus on the veggie first approach. The risk of protein malnutrition after these surgeries, if they're uncomplicated, is essentially zero. It's not something we see. The risk of weight regain is substantial. It's real, it happens, and we have to target our efforts towards the things that actually happen. And a protein-first diet is not the best diet to prevent weight regain. A veggie-first diet is the best one. We know that. Eating lots of animal protein causes obesity. Eating lots of vegetables causes you to be thin. That's really not a debatable topic at this point. And so from my perspective, we treat the problems that we see most likely, and we don't take steps to ensure that you don't suffer from malnutrition, which quite honestly, we never see in patients who are eating in a normal way. So I think that's something you'll have to talk to your bariatric surgeon about. My Pound to Cure weight loss website has a ton of information on how to adopt this approach, how to eat this way, and how to address, some of these issues that come up after surgery. All right. So let's wrap this up. Thank you very much for all your questions. Took a little bit of a hiatus over the summer. I'm going to try to do one of these once a month or so. I'm playing around with a little technology too that may kind of spice things up and make them a little more flashy. So maybe the next time I can make it a little more creative as well in terms of potentially being able to show videos or other things up on as part of this streaming process. So anyway, thank you for your attention, and we'll see you next time.